This is part 2, Whitney Ensor Sharp Debridement video. I remembered this time to turn the camera off so that my video wouldn't be an hour long, and have continued in the time that the camera was off. I have this amount of pairings, and I think I've actually gotten a little bit better at knowing the angle at which to go. So again, I'm just going to show you a few more between the third and the fourth digit, and then finger and index and thumb around the scalpel serrations, and my fingers are wrapped around the scalpel to keep it secure, forearms resting on the supporting surface. And I'm just going to make a few more cuts. I want to make sure that that's showing up in the video correctly. So with the curved part, I just angle down slightly. My forearms are still on the surface. And then once I get under the skin, just continuing across with the blade flat and parallel, and I'm cutting with the curved part. And I'm going to get that shaving off. I was hoping to get a really nice big transparent shaving to show you. That's not bad, except it doesn't really show up on the camera. Hope you can see from that. It kind of rolled up on the blade, but that's a nice transparent. I might show off one of the bigger ones in a minute, just to make sure the camera's picking up on what I'm doing. And I have found when this moves off of that bony prominence, it is definitely harder to cut, but I guess patients will come in with calluses. I know I've seen some bad runner's calluses on arches, which, if any of them would ever let me slice on it, I'm sure that's a hard one to get to. So that is good practice that this is moving off the bony prominence. Oh, here's some nice ones. And I will stop here for sake of time, but I'm going to try to move these to the tip of the scalpel so that the camera can see what just came off of there. That is a fairly big flake of skin that is transparent. So I feel like I'm at a good stopping point now. The tissue is lighter pink. I did not get down to the flesh tone, which shows that I stopped debriding before I reached viable tissue. I'm double checking my list. You need to see the flex. You want to see where I went to the red dye that it got lighter. I'm hoping that shows. This aspect looks very dark. I don't know if the camera's going to show this. This is actually wrapped around on the wound surface, and I'm not going to be able to get to it. So the this dye ran more than I thought it would. It ran down around to the other edge, so there it doesn't. The way it was angled made it look darker. But I do feel like I got, put this up really close, the majority of that callus and did not go to viable tissue. So we'll move on to the next section. Again, I don't know if this showed up very well, so I'm going to go back and show that again. And I also at one point, I don't know if you can read the part that says tracing. There we go. At one point when I was measuring the tracing, I started to go back and measure the second dimension of the actual wound. That was probably just me trying to be quick. But I do realize we were measuring the greatest length and greatest depth of the actual wound, then the greatest length and the greatest depth of the tracing. I'm sorry, not depth, the greatest length and the greatest width of the actual wound, and then the tracing, each in centimeters. Then we calculate the surface area in centimeters squared. The purpose of this was to show there is a discrepancy between the two. In a clinical setting, you would always stay with one method. If you started out by measuring the actual wound, you would stay consistent and continue to do that. Or if you wanted to measure by using the tracings, just be consistent and stick with one or the other. Okay, so moving on to the cross-hatching. I'm going to use the number 15 scalpel blade, and this one is held like a pencil. So this is the number 15. I'm going to hold it just like I would a pencil. I have it in my web space. The challenge here is the depth and using the blade correctly. You want to use the curved part of the blade and not the point, is what they said was the biggest mistake we would make, so I'm going to be sure I don't do that. And I'm looking at the instructions and the rubric to make sure I get everything. Leave the hand hook on its side and the blue spot on the skin. Use the 15 like a pencil. Avoid penetrating with the scalpel point, yes, and we want it just through the depth of the die but not beyond. And now looking at the rubric. First web space, my forearms are supported. Use the curved part, and we want parallel and perpendicular, moving this closely. So I'm angling this so it's almost parallel to the surface so that it is truly the curved part that is making the cut and not the point. I'm going to take that out of the bowl. I don't need that bowl to stabilize it. And it's keeping me from getting in the position I want to be. So I'm just going to follow that same cut so that I remember where it was. And then I'm going to do another one parallel to it. And another parallel. So I'm going to make 9 cuts total. And then turn. These cuts are perpendicular to the first 3 that I made. And again, check in the camera to see if you can see this. I'm using the curved part of the blade to cut. Making sure I just penetrate the die and do not get to viable tissue. Okay, so I just made 9 cuts. Check in the rubric to make sure I got everything you need. So you now need to see this up close. So I'm going to pull this apart so I can see it first. And then if I see where I made a mistake, I'll fess up to the camera. I see cuts, but it doesn't look like they're slush toned. So that's a good thing. So I'm holding this up to the camera. I cannot tell from the resolution of my camera if this is good enough, and I'm working in the mirror image. Oh my goodness. Okay, so I think that's close enough, and I do think you can see the tic-tac-toe marks, but that it doesn't appear any of them went down to viable tissue. There's one across the top that may have. I can't tell if that's one of my cuts or if it's just the angle, so let's double check that. That might have just been a camera angle. So again, showing that to you all. I don't think it goes through to viable. There does look to be some lighter areas there, but I don't think it's that the cuts went too deep. If I had spread that apart, if I had seen flesh-colored tissue where the cuts were, that would tell me, oops, I went a little deep there, and I would have mentioned that. So I think that looks okay. Makes at least 3 cuts total that are the proper depth. No white viable tissue showing. It does look like that happened. So I'm just double checking the rubric, and it looks like we got everything we needed. Okay, for this last part, I'm now going to debride with the forceps and scissors. And again, for the sake of brevity, I will start this and then turn the camera off so that my video is not too long. How are we doing on time here? Okay, so far so good. So I'm going to do this with the forceps and scissors. I'm also going to get some of this that we don't need out of the way. So, I have the scissors, which are going to be held in the thumb and the 4th finger, and then the index finger is on the shaft of the scissors. And in the video, you all showed with the curved tip up, so that's how I'm holding it also. Move that over. And then in the non-dominant hand, you have the forceps resting against the first web space or the palmar surface. I'm definitely going to use the first web space option. And then what you all really want to see is that when I use the scissors, that I use half to the 3rd area of the scissors as opposed to the tips. And we don't ever want to angle the scissor tips down into the wound. And you want to see that I get blue dye but not viable tissue on my snippings. I'm going to get a nice little new clean napkin for the snippings. And I'm hoping this comes across. My forearms are supported. If I were doing this at a patient's bedside, I would have a rolling stool is what I used to use and good lighting, but easier said than done sometimes. So I'm now going to start debriding. So I'm lifting with the forceps, cutting with the middle third. Does that show up? I'm going to hold that up against that white cabinet. And I'm not sure you needed me to hold that up, but just to be sure. So again, I'm checking the camera. Can you see what I'm doing? Yeah, it looks good. And again, I know it is hard to tell with camera angles, so I'm just kind of talking through what might not show up. My forearms are on the surface. I'm keeping the scissors parallel or even the tips. This flesh wants to stick to the forceps. Even the tips pointing up so that I'm not pointing the tips of the scissors down towards the patient. And in the handout they mentioned that if this is necrotic tissue, this should not be painful for the patient. So hopefully this would be a fairly peaceful process. I don't recall that from when I observed therapists doing wound care where I worked, but that's a whole nother story. And I do have, it's hard to tell where the gloves start and where my fingers end, so I'm going to talk through that. I have my index finger stabilizing these scissors, and the glove is flapping out beyond my hands. So I'm angling the scissors up away from the patient, and then cutting. And this is still pretty dark blue, so I have a ways to go. So I'm going to turn this off. This video is going to end up being in 3 segments. But I will do a few more before I turn this off. I'm also going to double check the rubric and make sure that I have everything covered that you need to see. Looks like it. Okay. I'm going to turn this off. We're going to take a break, and I will come back after the debriding is almost done.